As the death toll rises across Canada, here in British Columbia, toxic drugs are now the leading cause of death for people under 59 years of age, accounting for more deaths than suicides, homicides, accidents, and natural diseases combined. Here at the Vancouver Area Network of Drug Users, known as VANDU, these pictures represent some of those that have lost their lives to toxic drugs. It also shows that accidental overdoses can literally happen to anyone from any walk of life, and BC is now seeing 7 deadly overdoses a day.
In this picture, everybody has passed away related to an overdose. It's quite sad and shocking, but it's more common than you think to look at a picture and see a whole group of people no longer here.
Brittany Graham is the executive director of VANDU. She says she knows close to 60 people personally that have died from toxic drugs.
Problem is that when people hear 7 people a day, is we hear it all the time now, 7 people. Like, those are real people. Like, they're, someone's grandparent or kid or anything in between. And so I think we are kind of so far into this crisis that it's like almost 8 years that people are sort of just used to it, and we shouldn't be used to it. This is a large amount of people in our province that have died, and it's a bigger issue than people are willing to admit.
It's been just over a year since BC launched a program to allow 2.5 grams of street drugs per person for personal use. The program is supposed to save lives, but has it helped at all? BC Provincial Health Officer Bonnie Henry wants to prescribe other out-of-the-box safer supply solutions.
It's providing regulated or pharmaceutical alternative medications, but not necessarily through an individual prescription. I think there are models out there that we need to look at. I think we need to keep this conversation going. My office is doing a special PHO report, and we're in the process of looking at what's out there in other jurisdictions around the world. We're not yet at a place where I can say this is one model. But it's not an either or. We've heard from many people that we need to have many different options for different groups of people.
Clinical studies have shown that Indigenous people are dying at a higher rate, and government officials are hoping that the prescribed safer supply program will be one of the many tools to prevent more deaths.
Prescribed safer supply policy should really aim to reduce inequities and decrease stigma and be provided in a culturally safe, trauma-informed way. We need to work with people who are disproportionately impacted, including Indigenous communities and populations, youth, others, to ensure we're meeting their needs and meeting them where they're at.
However, despite these measures to try and help, Brittany Graham points to a major hole in the safe measures currently in place.
Here in Vancouver, a lot of people who are Indigenous actually smoke their drugs as opposed to inject their drugs. Most overdose prevention services do not cater to smoking because of work-based BC legislation, whether it's like the municipal legislation, those exemption requests. So all those things lead to us not being able to open safe inhalation spaces as easily as like overdose prevention services for injection.
Tina House, APTN National News, Vancouver.